We just told you about an Israeli cure for prostate cancer. But what about patients with different forms of cancers who undergo chemotherapy or people who are concerned that they could get cancer? The Israeli company MDSure says that a lot of the problem is that people aren't doing the right things to help their bodies fight off cancer, and they have a solution. The company comes up with an individual nutrition plan for patients that's based on scientific research and helps them strengthen their body so it will have the best possible outcome with its cancer treatment. Dr. Dorit Arad has more than 25 years' experience as a medical researcher, and she's here to tell us more. Thanks for coming in. So first of all, what does MDSure do?
MDSure finds out about the metabolic profiles, the personal metabolic profiles of the patients using state-of-the-art tests that are done in the US.
Is this what you brought with you?
Yeah, these are the tests.
Okay.
That are done actually in the US, but afterwards I get all the results and we analyze it and get a complete metabolic profile. In the metabolic profile we find out what the cancer needs as nutrition and how it gets its energy. And using this information we come out with a protocol, a nutritional protocol, that tells the patient what he needs to eat to starve the cancer and which supplements he needs in order to strengthen the body and also starve the cancer.
Oh, fantastic. So is this treatment a standalone treatment, or is it something you would also recommend with other cancer treatments like chemotherapy or radiation?
From our experience, like more than 3 years experience in the field, we find out that the best results are achieved when the treatment comes in a synergistic way with the regular treatment.
Fantastic.
We even do a scheduled protocol that changes during the period of the chemotherapy or biological treatment or whatever.
Now, is this appropriate for people in all the different stages of cancer, all kinds of cancers?
Yeah, actually, yes. It applies to most stages of cancer. Of course, in the stage that the person cannot eat or get anything, I mean, in a terminal stage, even then it can apply. I mean, even then I have examples that the person suddenly made a change, a switch, and
Oh, fantastic. So on that note, can you tell me a couple success stories, maybe some people that have come to you and you've been able to help them and it really has made a huge difference?
Yes, I have several success stories. I've treated like more than 180 patients in Israel and some in the US. And I'll tell a story about a woman, a great lady, who was diagnosed with colon cancer with huge metastasis in her liver, and not with a good prognosis. And she made a change in her diet. She did all the tests. She started chemotherapy with the change in the nutrition. And in half a year, in a combined chemotherapy and nutrition, the main cancer has disappeared.
Wow.
In the colon. And her liver metastasis became from like 30 centimeters to 1 centimeter. And from that period, she became very adherent to the program. And now she's like 3.5 years after, and she's well and healthy.
Oh, that's fantastic to hear. How did you come up with this program? It's obviously very different than traditional chemotherapy or radiation. What made you think of this?
First, the information is in the literature and in the scientific world for a long time. So it's known that certain nutrients, like certain amino acids, like methionine, for example, they, if you deprive the person from methionine or laboratory animals, the tumor shrinks.
Wow.
And there are many, many studies like this for different amino acids. But somehow this method was not applied into personal metabolic treatment. So that was, I thought that I can contribute in this by doing metabolic tests, analyzing the data, finding out which nutrients the cancer needs and how it gets its energy, and deprive these nutrients from his diet.
Wow, fantastic. Well, I'm sure some of our viewers watching this are going to want to contact you after hearing this. It sounds incredible. Thank you so much for coming in.
I hope.